My name's Kim Meyers, and I'm a pastor at St. Andrew in Plano, Texas, and I primarily work with the worship teams, but also I work with and how people engage with their faith in the church. In my time here at St. Andrew, I've had many different roles. It started in the family ministry, where I worked really closely in some really hard situations, mainly that had to do with death by suicide. And I will never forget walking out of those rooms without the support and the education that Beacon Light has given me. It was over 5 years ago now. My phone rang around 11:30 at night, and it was our senior pastor. He let me know that one of our youth had died by suicide. That's never a great call. The next day, though, I'll never forget being in the conference room with my staff and my team and my senior pastor, all broken, all looking at me to help when I was also broken. I didn't quite have the right words. I didn't quite know what to do next. And I left, trying to hold it together for them, but really broken on the inside. Then there was a situation recently where we, again, had a young man who was actually my own son's age die by suicide. And I got to rely on the education that I had been given, the hope that I had been given by Beacon of Light. It wasn't just on my shoulders as a pastor. It was shared language amongst our pastoral team, amongst our family team. And also I knew the resources to give people to help them for their next stages of grief. It wasn't just on me, it wasn't just on our team, it was now a community that could surround somebody with the right resources. And it gives me the ability to keep myself healthy as a pastor and help those who are coming to me get the right help that they also need. One thing I'd say to churches if they're questioning about why become a partner with Beacon of Light? When it comes to mental health, we must be at the forefront of giving people resources that combine faith and true practices that can give people wisdom and guidance. We're not going to fix things. We're going to give people tools so that they can go about their lives in a healthier way. And we now have the ability to help people for where they're at get to a better place.